Hello, hi everybody. It's a nice afternoon here today in KL. We're at the Columbia Asia Management Office in Subang Jaya, and I would like to say welcome to our special guest today. He is Dr. Silvam Sellapan. He is from Columbia Asia Hospital Puchong, and today he will be talking to us about gynecological cancer. How are you, doctor?
Yeah, I'm fine. Thank you. Yeah.
That's good to know. Okay. Dr. Silvam is a consultant obstetrician and gynecologist with a special interest in gyne-oncology. So without further ado, I will pass the mic to Dr. Silvam and he will explain more excuse me, about gynecological cancer. Silakan, doctor.
Thank you, Sagina. So in this brief session, we will go through overall what are the gynae cancers, and then what are the incidences in Malaysia. There are some latest figures which only got it recently. I think the results came back last year, 2019. So I will share some of the slides. Maybe you can show the slides. Right.
Okay.
The next one. All right. So, how do we know how many people get into this cancer? Cancer, maybe no need to worry. Cancer is most cancers, if we early detected early, it is curable, right? So we need to understand that. But how do we get a rough gauge? What are the numbers we get in Malaysia? We have a lot of figures throughout the worldwide. We have a lot of numbers, but then there's something called Malaysian National Cancer Registry, which was started in 2007. That was the first 5 years registry. The second one is 2012 to 2016. The data only came out last year, 2019. But this National Cancer Registry is a passive collection of information from various centers, including our center, Columbia Asia. Right. So once we treated the cancer case, we will send the data to the National Cancer Registry. The second one,
it's like a database, doctor.
It's a database. Yeah. Right. The second one is something which many people wouldn't know. It's a healthcare performance measurement and reporting system. It's a very interesting system which analyzes how the patient can enter a hospital, how the treatment can be faster or delayed because of various factors. Okay, we will go through this a bit later. The next. Right. So these are the figures from the 2012 to 2016 National Cancer Registry. So about 115,000 cases were registered, and about 45% males, about 55% females, right? The cancer registered. The cancer incidence increased for both groups compared to the 2007 5 years collection of data. So the fourth one is very important. About 64% of cases were diagnosed at advanced stage. That means stage 3 and 4. So this is very important because so many patients only come for treatment at late stage. This is important to be known lah. That means early detection is actually somehow didn't happen. So about 64% came very late. A significant increase in the number of newly diagnosed cases like breast cancer, colorectal, and lung cancers were noted. So these cancers, there are some reasons why breast cancer detection was increased, colorectal cancer detection increased, and lung cancer increased. We will discuss in coming slides. Next.
Okay, so that's good news.
Yep. Good or bad, we don't know. Why is here? The next slide. 10 most frequent cancers in 2012 to 2016. Breast cancer. Breast cancer is known to be number one actually cancer throughout the world. Many years. It accounts usually 1/5 of the all cancers. So in the last actually data collection is about 19%. Used to be about 20% lah. Overall, this one is female and male. So you have about 10 cancers and others about 30%. Right, 19%, and you want to know about gynecological cancer, breast, it's listed cervical cancer about 3.5% and ovary about 3.1%. So this is both males and females. All right. So if we see only female cancers, the next slide will show the female cancers only. Right. So these are the 10 most frequent female cancers in the 5 years. If you see, the breast cancer accounts for more than one third. More than one third of all female cancers are breast cancer. So why the number is keep on increasing? This is probably, you said, is good or bad. Good because there's awareness. People go for screening. That's why it's good. But of course, when you say the disease is bad, of course, we don't want too many people with 34% of breast cancer. And then majority of them go to see the surgeon or gynecologist at late stage. As we see in the previous slide, 64% of overall go and see a doctor at stage 3 or stage 4. Right. So if you look at other cancers, of course, colorectal cancer is in increasing number. It's a surgical cancer. But coming to gynecological cancer, cervical cancer, the number is slightly reducing. Also, because of various factors, various treatment modalities, treatment investigation modalities, screening modalities. We will discuss a bit later, this one. And ovarian cancer is about 5.6%. And the other cancer noted to increase in the second study, National Cancer Registry, is corpus uteri. This is the womb cancer. We call it endometrial cancer. The number is also keep increasing. There are some lifestyle factors which cause this increase in the number, which we'll discuss in a short while. Right? The next slide.
These figures are for Malaysia alone?
This figure is Malaysian figure. All these figures I'm showing Malaysian statistics. This is from Malaysian National Cancer Registry, right? So these figures are all only Malaysians and permanent residents.
I see. Okay. All right.
Malaysians and permanent residents. Yeah. The next one.
Okay.
So just now we're talking about the healthcare performance measurement reporting system, which is important because this one analyzes in used in various modalities like cardiac care, cancer care, eye care, and health tourism. So this one actually actively analyze where is the loophole for, especially for cancer care, why the patient come at very late stage. So this study is important. The next slide, please. Okay, what is most important in cancer care is survival. Survival is the index of overall effectiveness of health services in the management of cancer patients. But what is the survival of the patient? Let's say if the patient come to a hospital, how well we can gauge whether the patient will survive well or do well for the treatment. So this depends on 2 factors. One, the stage of cancer. If they come very early, majority of them can be cured. Majority of them can be cured if they come early. If they come late, then it will affect their survival. Second thing, there are a lot of people have a lack of access to optimal treatment. They don't get optimal treatment for various reasons. It can be they cannot reach the hospital, poor knowledge, financial issues. There are many because they can't access to the treatment. Although we have a lot of hospitals, a lot of treatment available, then the awareness is poor, right? So there are always in the worldwide, there are persistent differences in certain groups, regional differences. Let's say Selangor may be different from Perlis, Sarawak from Kuala Lumpur, and also differences in international level. So these group differences actually can cause a poor survival rate, which can affect the overall performance of the treatment modalities, right? So this is a very important survival of the patient. What are the factors affecting the survival of the patient, right?
Okay.
Yeah, you have any questions, Sakina?
For now, no, I'm good. I can follow you.
Yeah. Okay. Next one, please. Okay, life expectancy of Malaysians from the National Cancer Registry shows slight increase in the survival rate of Malaysians. So women actually increased from 76 to 78 years, men from 71 to 73 years, right? So life expectancy increase means that actually more healthcare need to be attended, because some of the patients develop these gynecological cancers mainly at a later stage, later age. So if they live longer, sometimes these actually chronic diseases need to be attended. So they need to attend early to live healthy until they live lah, right? So life expectancy increase, so we need to increase their health care so that they healthy. Correct.
Okay.
Next. Okay, most of these gynecological cancers usually will be after 40s, or after 30s. Some cancers, about less than 3% of the cancers, or 3 to 5 or 6%, usually will be below 30s, right? So most cancers at the prime age of the person, right? The person, see, what is our prime age? Usually we study, we do our early work, and all that things we achieved after marriage and all these things. So you come to a stage about 40, you're quite comfortable with life. So that's the time actually most of these gynecological cancers can affect the person, right? So this is important to understand, because this is where you need to have a good screening, good awareness to get the disease at the early stage, right? Thank you. The next one.
Sorry, doctor, can we just go back to the earlier slide? Okay,
Yep.
it says here female cancers, ovarian 6% of childhood cancers. Does this mean that among children there is also such a thing as female cancer and ovarian is one of them?
Yeah. Ovarian cancer actually account for 6% of childhood cancers. But overall, if you take ovarian cancer per se, only 3% of ovarian cancers are below 40 years old. Only 3%. Let's say 97% is above 40. But this figure is showing percent of childhood cancers. That means compared to all the childhood cancers, the female cancer accounts for about 6%.
I see. Because I didn't know that children can also get female cancers at such a young age, because you usually hear children getting leukemia,
Right.
or those kind of cancers than ovarian. I mean,
No, they do get ovarian cancer, but it's a different variety. It is called like a germ cell tumor in the much younger. Of course, any cancer can occur in any age, but we are talking about the numbers. The majority of the cases are for ovarian cancer per se is above 40.
I see.
Right?
Okay, all right, yeah.
Okay, so what are the cancers we are concerned? The breast cancer, of course, as we saw the numbers, is the number one killer throughout the world. So there are a lot of about breast cancer. Actually, the national level, actually, the government is providing free mammogram program in all hospitals, including our hospital. So we are providing free screening for breast cancer. Somehow is supported by some of the NGO organizations like SOXO, things like that. So to create increased awareness. This is one of the reasons why breast cancer, the detection rate is higher. Just now we saw the number is increasing about 34%. So the awareness is more screening is being done. Patient is being taught how to do their self-examination. So that increases the number of detected cases, right?
Yeah.
Cancer, also actually a lot of new advancement has been made throughout this past 10 to 15 years. We'll discuss it after this. Ovarian cancer is always a hidden cancer because it's inside the body. You can't actually palpate or what. So many of the patients comes quite a bit late. So we'll discuss a bit later. So endometrial cancer is another one which shows increase in the detection cases. There's a particular reason for this. I will explain short while. And the other two cancers are trophoblastic cancer and vulval cancer. Vulval cancer usually very late stage, usually in 60s and 70s. The trophoblastic cancer is something associated with pregnancy. All right. So these are the important female cancers, female or gynecological cancers.
Okay.
The next one. So, okay, why it is important? The cancer actually causing a lot of disturbance in the lady's life. As I mentioned just now, the cancers usually affect them in their prime time of their life. That means they are just getting a promotion, let's say in a career after 40, most of us getting good promoted to a good position at this age. Children are still in the school, they're going to university. The family dynamics are disturbed if the lady got some sort of cancer. If you just break the news, a lot of things will be disturbed. She can be a wife, she can be a daughter of somebody, or she can be a mother who is taking care of the children. So the question usually will be, am I going to die? Is it going to affect
Yes.
my lifestyle? So this is very important because the cancer is affecting at the most important part of their life.
Yeah.
So that's why we need to create the awareness so that they get detected early and can be cured if possible.
Yeah.
Right? So the next one.
Correct. Yes.
Okay. So we specifically look into the cancers I mentioned just now. So we know it's affecting at their prime part of their life. 1/3 of breast cancer is detected in from 40 to 49 years old. So what are the symptoms usually they have for breast cancer? So as I mentioned there's no symptoms. That means the lady wouldn't know she have a breast cancer because she don't have any symptoms. So how do they know she have cancer? So that's why we encourage those who are above 40 must learn the techniques of breast self-examination. So they can do their checking at home on their own. The doctors can teach them, or maybe they can learn from internet. Various sources are available to know. They must learn the technique of breast self-examination. So early sign can be breast lump, which can be detected via the breast self-examination, and they can actually consult their doctor to get appropriate treatment. A late sign only will be pain and bleeding at the nipple and all. So of course, we try to avoid the late sign. They need to come early after their breast self-examination. Talking about mammogram, it's available in all the hospitals, many of the hospitals available. So mammogram is encouraged, and also actually I mentioned just now, since 2008 in Malaysia, many of the centers are offering free mammogram. So if they can actually get into some sort of system where there is a free mammogram is there, then they can go and do the mammogram. Mammogram is a very important tool in detecting breast cancer, right? So the good news about breast cancer is the 5-year survival rate is more than 90% in stage 1. They usually will do well in stage 1, and stage 2 is still about more than 80% will survive well or come out of the disease. The care is usually will be from multiple disciplines, and it depends on the stage and various factors like grade, lymph nodes involvement, whether the other factors are there like receptors, things like that. So these are the facts. But what we need to know about breast cancer is if let's say it's a family history, if the family history is there, maybe the detection or maybe the self-examination should be much earlier, maybe from 35 onwards rather than 40. But it is no harm if no family history. You can actually start from 35 breast self-examination, which is no cost in your own room. Privacy is there, but the awareness and are they giving importance to this? That is important, right?
Yeah.
Okay.
Yeah. Well, we
So
do have
next,
breast cancer awareness campaigns every year.
pardon again.
Breast cancer awareness campaigns every year. I mean, that's to stress on the importance of
Correct. It's usually done in October. October,
yeah.
I'm not mistaken, it's in October. Yeah, actually, there are a lot of programs run, but most of the patients take for granted. They don't really bother. But of course, it's a continuous effort, effort to make the awareness. So awareness. Sometimes I recently had a patients actually just staying in front of the cancer center in Putrajaya. But 1 year she waited to go and get treatment from the cancer hospital. So she was just in staying, her house is in front of the hospital. But you see, this is like poor awareness. So they don't realize the importance of going early and get the treatment so that they can come out of the disease. Right?
Yeah. Right. Doctor, in terms of survival rate, as you mentioned just now, when you say 5-year survival rate, does that mean that counts from the point that you are diagnosed with the cancer?
Yes, yes. 5 years. That means after diagnosis and the treatment. If you treat at stage 1, more than 90% of survival rate. That means 5 years, they don't have any cancer effect or cancer. After 5 years, let's say if they don't have a cancer, they are considered as equal as the person who never had cancer.
Oh, I see.
So after 5 years, you are equal to another person who never had cancer. That means you go on the same par. That's why it's 5 years.
I see.
All right? All right. Next one. Okay, so this is like earlier I mentioned, the survival depend on the stage of the diagnosis to optimal treatment. This is where actually the system, the health performance measurement and reporting system is important. This was done on a research basis in many places, but then whether we are actually embracing it, where is the problem? Whether the patient knows she has the disease, she knows, but she refused to come to hospital. But if she come to hospital, is she at the right center? Is she at the right hospital? Is she seeing the right doctor? These are all important because sometimes patients go to hospital, never get appointment. And recently, during the COVID-19 pandemic, many of the patients cannot have access to the hospital. In some hospitals, they cannot because of the pandemic. But that is one issue. But even without the COVID-19, the access to hospitals sometimes is, for various reasons, not achievable. Maybe sometimes they don't have transport, they don't have money, no one to bring them because they're elderly people. So the various reasons can be identified from this health performance index, the system. So this is important for us to realize and then educate the patient. Of course, the caregivers also, like let's say our hospital, need to analyze this. Where is the problem? Why the patients are not coming forward for the early treatment, right? So this is important, right? Next one. Okay, next one, we'll move into cervical cancer. This diagram is just to highlight where is the cervix. Cervix is the lower part of the womb, right? So next one, please.
Lower part of the womb. Can we see that again? Which part? Because there are a few abbreviations.
Okay, lower part of the womb. Yes. All right, this is the womb. This is the vagina. This is the womb. This is the lower part of the womb. This is the body of the womb. This is the body. All right. So there are two cancers we are going to talk about the womb. One is lower part of the womb. This is cervix. All right. This is the cervix. The next one will be the endometrial cancer. Is this? Okay. This is the cancer which the 2012-2016 data showing the number of cases increased in this part.
Actually, doctor, the viewers cannot see where you're pointing. Sorry, you were saying. Can you point again? Can you point again?
I'm pointing here. The cervix. Can you see?
Right, yeah. Can yes. Sorry. Yeah.
Can you see?
Yeah.
Okay. The second one, endometrium. This part.
Okay. All right.
Okay. We concentrate on the lower part, the cervical cancer.
I see.
Next slide. Cervical cancer. Cancer pangkal rahim. Cervical cancer is cancer pangkal rahim. All right.
Okay.
So cervical cancer, there are tremendous achievement and progress has been made in past 10 to 15 years. This is cancer not familial. That means it's not like genetic preponderance. It's purely 99.9% of this cancer is due to human papilloma virus. Right? It's important to understand a cancer due to infection, So the conventional method of screening is pap smear, conventional pap smear, and also there are actually standard nowadays is liquid-based cytology. Another milestone achieved in screening of cervical cancer is HPV screening. Now actually is being introduced, but not commonly used. HPV screening, you can screen the person only 5 years once. Like if you use pap smear, it's only once a year, every year. This is an advancement in screening of cervix. So something which we need to aware about that. HPV screening can be done, and it is only like a 5 years once. Like something which is like in our neighbor countries in Singapore, they're already like embracing it, and they're doing actually for most of the patients HPV screening. We are still doing a lot of pap smears, but I think slowly there'll be a move to HPV screening, something which is like coming up. Of course, there are other modalities of treatment, colposcopy, and cone biopsy. But the one is very interesting, which was actually very fascinating, is the vaccination. Right? Vaccination was actually is fortunately introduced by our government 13 years ago in our healthcare system. Vaccination for young girls at 13 years old. The program is being implemented in throughout the country in all schools. So all girls from 13 at 13 years old given vaccination for the past 13 years. That means from 13 already up to 26 years old, the girls who become young ladies already being vaccinated. That means majority of Malaysian ladies up to 26 years old already being vaccinated with cervical cancer vaccine. But those who are left over from 26 up to 46, they can go to one of the healthcare center to get vaccinated because cervical cancer is a preventable disease. So if you have vaccination, you are up to about 90% can prevent cervical cancer, and which is one of the very important and common female cancer. So this one, I think people should be very much aware. Of course, it's a cost for those who are going to the centers, private centers to vaccinate, but it's worth the money because you're preventing a major cancer and plus a major surgery for the cancer. But those who are already being vaccinated from 13 up to 26 now, they need to go for any further vaccination. They are already covered, and the vaccination is considered for lifelong at the moment. So that means there is something good from given by our government, actually, the vaccination program, right? So the treatment, surgery, chemotherapy, all these things are for those who are already having the cancer. Right, so this is very important. Cervical cancer, a lot of tremendous achievement in the modalities, and the pap smear is now slowly is going to change to HPV screening. Plus, people need to know about the vaccination is available throughout Malaysia. Right.
Otherwise, it doesn't have any symptoms.
Yes, Sakina.
Otherwise, I mean, if we don't do any of these tests, there's no other way for us to know. There are no symptoms.
No, they can have irregular bleeding, irregular vaginal bleeding, which already if the cancer is there, then you can have vaginal bleeding in between the menses or after coitus.
But that would be a late stage already.
Not to say late stage, it may not be late stage. Bleeding in between menses or after coitus may not be late stage, but it is one of the symptoms. But what we try here is, can we screen this and can we eradicate this? This is important. Screen means that means without symptoms, if we screen, we detect, we can treat. And vaccination is one step forward. Can we vaccinate to avoid this disease or eradicate this disease? This is important to understand. All right?
All right.
Okay, next one. Okay, so we move to ovarian cancer, right? Ovarian cancer is something which is patient always, most of the time comes very late to the clinic. Most of them, as we mentioned earlier, is after 40, only 3% below 30 years old. Generally, 5-year survival is poor. It's only 25 to 30% because most of them come late stage, not to blame them, because the organ itself is sitting inside the abdomen. So it is not visible, not palpable. So most of them will be thinking they will be putting on some weight, some fat tissue is there. So when
Wow.
already it is stage 3 or sometimes it's stage 4. So it's difficult sometimes. There is a tumor marker available, CA125, but the
Mm.
tumor per se, if it is normal, doesn't mean the patient don't have cancer. It is a non-specific tumor marker. So what I suggest is usually the ladies above 40, they should go for screening once a year. That is important. Once a year to detect whether they have early cancer,
Mm.
which can be treated and can be cured. But sadly,
How do you detect?
inside
You
the
were saying
body,
now women should go to check once a year. But what is
at
the
least
is it like an ultrasound or pap smear?
usually if you go to the gynecologist, they will do an ultrasound of the abdomen, the pelvis, and they can do an internal examination plus transvaginal ultrasound to make sure the internal organs like the womb, the internal area of the womb, that means the
Mm.
endometrium plus the ovaries appear normal. The
Okay.
appearance.
Sorry. Sorry, you were saying the appearance?
The appearance can give some clue whether there are some changes in the ovary which can be changes which can be cancerous lah.
I
Right.
see. Okay. Generally, doctor, when you go for tests to detect cancer, for example, when it comes to cervical cancer and ovarian cancer, can you do one test or you can't and you have to go for specific tests? I mean, it's just that because some people, they would not, they would rather not go to the hospital repeatedly for tests.
So
And
you can do all at one go.
okay,
You
so
can
if you check for ovarian cancer,
why,
you can go.
yeah, why you need to go for many times? You just go one visit and do the both checking can be done, and then you can go back to home. Right. You
Health
don't need to
screening,
go
lah. Health
multiple
screening.
times. Yeah. 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 Yeah.
Oh, I see. Okay. Okay.
Okay.
But also surprisingly, these tumor markers, because I think it's quite misleading. A lot of people think that when you have a tumor marker test, that means you can already know whether you have these certain cancers or not. But it turns out that it's not totally reliable.
No, it is a non-specific tumor marker. This tumor marker is good for follow-up of cancers. That means if a person have a growth or cancer, this tumor marker, if it's initially high, it can be
Mm.
used for follow-up. Okay,
Okay.
but then let's say for the beginners, if the
Yeah.
tumor marker is very high, it can be an indication of ovarian cancer. But
Nice one.
if the tumor marker is normal, it doesn't mean you don't have a cancer. That's why it
Right.
is considered a non-specific tumor marker. It is not
Okay.
specific.
Okay.
All
All
right.
right. All right. Okay.
Okay. Next one. All right. Okay. This is just a picture of ovarian cancer. All right.
Mm-hmm.
Okay. Coming back to this, the National Cancer Registry shows the endometrial cancer is increasing. Why it is so? What have changed in Malaysian lifestyle? Okay,
Mm.
endometrial cancer depends on the estrogen level in the body. As we know, many of us, I'm sure we have seen many times, a lot of us are actually overweight and obese in the Malaysian society, men as well as female. When your weight is higher than normal, the fat tissues also can produce estrogen, which can contribute to the development of endometrial cancer. So our lifestyle, our body weight, obesity can contribute and can be one of the risk factor for development of endometrial cancer. So
I see.
that's one of the reasons which is contributing to increase in the number of endometrial cancers in Malaysian society, which is correctly indicated by the National Cancer Registry, right? Similarly, breast cancer also actually the number is high. One is, of course, is awareness, more detection, more screening, but also the lifestyle and body weight, the amount of estrogen, all these things can contribute in the increase in breast cancer as well, and endometrial cancer, right? So endometrial cancer common after 60, but need to exclude in any women with abnormal bleeding. Abnormal bleeding after 40 years old, they need to be investigated for endometrial cancer. For those
Alright.
who do not know what is endometrial cancer, it is the inner part of the womb. It is the inner part of the womb. So
Yeah.
treatment investigation can be done, sample can be taken, and treatment can be given. If it is
Okay.
detected very early, endometrial cancer is one of the easiest cancer to treat.
Easiest cancer? What do you mean by that?
It can be completely confined to the space of the inside the womb. Okay, because
You mean
it's in a
it won't spread to the other organs?
of course, it must be early, detected early.
Oh, yeah, I see.
Early
All right.
detection. It means if she has abnormal bleeding after 40, in bleeding between the menses, she need to be go and see the doctor. Maybe they'll do some sampling of the tissues if it is detected. The other thing is if she have a risk factor. What are the risk factors for endometrial cancer? I mentioned just now obesity.
Yeah.
If she never give birth, nulliparous, that means never had any chance of giving birth,
Yeah.
diabetic mellitus, and we are actually one of the commonly we have about 30% of our population are diabetic. Diabetes also contribute to endometrial cancer. So
I
all
see.
these risk factors, if they have risk factors and they
Yeah.
don't have a regular menses, they need to go for screening. So these are the things to remember about endometrial cancer,
Yes. Okay.
right?
All
The
right.
next, yeah. Okay, abnormal uterine bleeding. See, abnormal uterine bleeding, that means they usually they have menses, but then abnormal uterine bleeding is common case of a consultation in the gynae clinic. 70%, maybe 70% of them come with this. But is all
Okay.
abnormal bleeding is endometrial cancer? No. Only about 5, the quoted figure is 5 to 7%. So only a small number of abnormal bleeding is due to cancer. Others all due to normal growth, normal swelling, and be due to fibroid, which are all benign condition. So
When
majority of abnormal
sorry.
bleeding in the uterus is
Mm.
not cancers, majority.
Okay.
But we need to detect the 5%. That means you are at the risk group above
Yeah.
40 and you have all the risk factors, we need to screen. Yeah,
Okay.
anything, Tina?
Yeah. When you mentioned abnormal bleeding, how would somebody know whether that? I mean, apart from irregular menses, what constitutes abnormal bleeding?
Yeah. Okay, good question. Abnormal bleeding, it's one is irregular menses. If they have heavy menses, let's say heavy, that means they have a lot of blood clots. It could prolong menses. Let's say usual menses will be 3 to 5 days. They have 10 days every month. Heavy
Yeah.
blood. So all
Right.
these things can be considered abnormal uterine bleeding.
Okay.
All right.
Okay.
Okay. All right. So the next one, please. Okay, next one is the molar pregnancy. Of course, is the small percentage of cancer. It's related or occur during or after pregnancy. Early detection and evacuation is must because it's related to pregnancy. That means if they're pregnant, it can go with the pregnancy or sometimes after a miscarriage, the tissues in the womb can continue to proliferate. If we don't detect, if we don't detect this cancer, if
Yeah.
this grow, it can grow up to become cancer. So this one, if let's say after delivery or after miscarriage, they have abnormal bleeding, they need check with the doctor, right? So this is to avoid one of the cancer called choriocarcinoma, which can develop molar pregnancy. This is related to can occur during the pregnancy or after pregnancy or after delivery or after a miscarriage. It's a special type.
Where exactly does this cancer go? Is it in the womb?
It's in the womb, part of the inner wall of the womb, right? So
I
they
see.
get.
So this is womb cancer, basically. Are we looking at?
We call womb cancer. Womb cancer is the one just now we mentioned, the endometrial cancer. This molar pregnancy occur in the tissues of the pregnancy tissues. We call it yeah, it's a separate thing. It's a separate thing. This one is related to pregnancy.
Okay.
Right? Okay, next one. This is called a molar pregnancy. It looks like this if you see the tissues, right? Call it identiform mole. Next one. Okay. Next one is vulval cancer. Is the external part of the genitalia. That means the skin part. Most usually at the late stage. As we know, the life expectancy is increasing. Just now we saw women life expectancy in Malaysia is 78. 78 is the average age. You can live up to 100 years if you take care of yourself. Abnormal growth at the skin or itchiness, soreness at the external genitalia need to be checked. If you go to the doctor, they maybe do a biopsy excision to rule out this cancer. This is called vulval cancer. It means the external genitalia, the skin part.
Right.
Next. Okay, so we just roughly have covered the important gynae cancers. As I mentioned, for breast cancer, important breast self-examination and mammogram. Yeah. So do you want to ask anything before? Yeah.
No, not at this.
Okay, continue. So the pap smear, HPV screening for cervical cancer, vaccination we have actually mentioned. If you are not vaccinated, if you are not vaccinated group in the school, they have covered up to 26 years old. So if you are above, you're not vaccinated, it's good to go and get vaccinated for cervical cancer. And then,
doctor, sorry, I saw this word twice just now. Colposcopy. What is that?
Colposcopy is a modality of diagnosis. It's a diagnostic modality. It's a diagnostic modality for cervical cancer. It can also be used to cure the early cancer or early pre-cancer. Early pre-cancerous lesion or early cancer can be cured with colposcopy, and there's something called cone biopsy. You can take out the whole cancer if it is early. That is how important to go early, detect at the pre-cancer level or early cancer, which can be cured with a small incision. That is what colposcopy biopsy. Yeah.
So colposcopy is actually using a camera.
Yeah, it is a camera. It's a microscope which can be viewed at the internal organ, the cervix. Yeah.
To see the cancer cells.
Yeah, to see the cells clearly, see which are the affected part, and then we do a biopsy, adequate biopsy, so that it covers and take out all the abnormal tissues.
Okay.
Right? Okay. So I mentioned about the tumor markers because some of them, they just go out and do some blood workout and then worry about tumor markers and abnormal cells. Blood checking alone doesn't exclude cancers. So you can do the blood checking, but it can be misleading. Sometimes it can be, of course, useful, but you need to go for a clinical checking.
Yeah.
Plus some other like ultrasound, things like that to detect any cancers. The blood tumor markers alone may not be helpful. All right?
Okay. Right. So do not rely on tumor markers.
Tumor markers, yes. The next one, please. Yeah. So what we can do actually to achieve or detect the cancer early. So we need to tackle the system failure. Where is the delay? Where is the problem in access? we, of course, education lah, education. So as we know, for the Malaysian government expenses, about 1/3 of the expenses is for the preventive purpose. 2/3 of the government expenses is for treatment. All right. So this can maybe changed in the government setup. Of course, is 50% maybe for preventive purpose, 50% for treatment. So this is at the government side. But of course, at the society level, what we can do? What we can do, of course, we create awareness, see where is the system is failing to bring the patient to early, to avoid the 64% who are coming very late for the cancer treatment. Financial issues always a big problem. All right. Wherever they go, some of them are really cannot go and get a treatment which is desired. And patient themselves, if they don't have awareness, they themselves delay the treatment. They take it for granted. They go very late, and they can't. They go like I mentioned just now. The patient go 1 year after late, although she's staying in the city in front of the hospital. This can happen, right? And then we always can review our performance index. Yes, Sakit.
Talking about financial issues, I mean, there are certain groups out there that can actually help with patients of cancer. For example, like BCWA, Magna. I mean, we can. It's an option that people can always explore if insurance is a problem or not.
Yeah, definitely. Of course, it can option. Of course, even last year also the government have actually given like a medical card about for 8,000 things like that. But all this actually probably not solving the problem. Not solving the problem. So probably more attention need to be given to this group of people who are suffering from financial difficulties to get the treatment for cancer.
Okay.
All right.
All right. Okay.
Is it the last one? All right. Okay. So remember, it's important to effective prevention, early detection, and enhanced public awareness. So this will actually these are general things lah. But of course, we for each cancer we have like a different type of like a detection and awareness. Yeah.
Okay.
Right.
That was very comprehensive, doctor. Thank you so much. Sorry, do you have anything else to say?
No, most important things like maybe even the hospital can actually run some programs. Any hospitals, like it can be a private hospitals or anything, they can actually run some programs to create the awareness and specifically maybe target what cancers we are actually targeting. Of course, like one we are doing the breast cancer awareness month in October, and similarly can be done for other cancers. And what are the new modalities of investigation and treatment? If the hospital can introduce to the patients, or maybe those who are coming to the clinic, we can create some awareness pamphlets, things like that. So many of the things, of course, we are doing it, but more can be done, right?
Okay. All right. Okay. So thank you so much, doctor. That was very comprehensive. Very. Oh, look at this cute girl. So now we can take questions from our viewers. I have one here from Miss Shirley Hu. Hi, good afternoon, Dr. Silvam. Is endometriosis related to gynecologic cancer? Thank you. I think this one we addressed already. The answer is yes.
No, I need to answer this. Yeah, I need to answer. Endometriosis, thank you, Shali. Endometriosis per se not related to cancer, but there are recent evidence showing endometrioma. Endometrioma means collection of blood in the ovary. Collection of blood in the ovary, if left alone without treated, can turn out to be endometrioid cancer of the ovary. That means ovarian cancer. That means if a lady have blood collection in the ovary, it is called endometrioma. It's part of endometriosis. It should be taken out or treated. If you left alone, endometrioma, this is collection of blood in the ovary and is becoming bigger. It is a risk factor for ovarian cancer.
I see.
I hope that answers the question.
Yeah, that was clear. Sorry, I think I mistook this for another statement. Sorry, my bad.
Yeah.
But okay, thank you so much, Dr. Silvam, for answering that. Let's see that we have quite a few comments actually. Everybody says hi to you. Okay,
Hi.
from me,
Hello.
Rafika. Hi, Dr. Silvam. For people with PCOS, does it increase the risk of getting cancer? Perhaps you can let us know what is PCOS.
PCOS actually is called a syndrome, polycystic ovarian syndrome. Yeah, polycystic ovarian syndrome. We need to look into it. What are the risk factors for ovarian cancer? So risk
Yeah,
factors of ovarian cancer is actually frequent stimulation of ovarian tissue. Like let's say for patients having like polycystic ovarian syndrome, these
yeah,
patients actually they don't have a regular menses, so their menses won't be regular. Sometimes they'll be like obese, and there are
yeah,
also of thin PCOS. But
yeah.
what is the problem with PCOS? PCOS patients usually go for a lot of fertility treatment. All right, fertility
Oh,
treatment which will actually enhance ovulation. Any treatment which enhance ovulation can be a risk factor for ovarian cancer. Okay, so any treatment which is enhancing the ovulation can be a risk factor for ovarian cancer. Apart from this, like I mentioned just now, endometrioma, like fluid in the ovary, can be a risk
yeah,
factor. And there are other recent evidence. If let's say for any purpose they're going for a surgery at late stage, let's say after 40 they're going for a surgery of any pelvic organs,
yeah,
the fallopian tubes which are inside the system, let's say the fallopian tubes are the conduit for the pregnancy to occur,
yes.
which is the sperm and the ovum. So it is advisable to remove the fallopian tubes, if possible, after they're completing the family. So that tube itself can be a risk factor for ovarian cancer.
Okay.
Yeah.
Okay. All right. Thank you, doctor. So next question we have from Ms. Shahila Azwin. Will it be hard for someone with gynae cancer to get pregnant? And does it affect one's fertility?
Okay. So it depends on what type of gynae cancer. If let's say you have a early cervical cancer which is treated, there is no effect. She can go ahead with the pregnancy and then she can get babies, right?
Okay.
Does it affect one's fertility? It again depends on what type of cancer. If they have
Yeah.
ovarian cancer, let's say ovarian cancer,
Mm.
early age. Usually, ovarian cancer at the early age will be called embryonal cancer. Maybe one of the ovaries need to be removed. Even with one of the ovaries need to be removed, it can she can go, get pregnant with the remaining ovary.
Mm.
But if you have to undergo a chemotherapy, then sometimes there is a technique called preservation of ovarian tissue. It can be preserved, and then after chemotherapy, she can get pregnant in other assisted reproduction.
Yeah.
But with chemotherapy, if one ovary is affected, the other ovary still she can get pregnant. But then
Yeah.
let's say advanced cancer all over. Sometimes then the organs need to be removed,
Mm.
which need to be discussed with the patient whether which one is like more important, either like saving her life or the pelvic organs. That can compromise fertility. Yes.
Yeah. Okay. All right, doctor. It doesn't seem that like we have any more questions. And we do have 6 minutes to go before 4 o'clock. So we've actually been running for nearly an hour, which is the longest for this program, but it was very, very good. I think this was one of the most informative sessions that we've done on our live. So I would like to thank you very much for your time.
Yeah.
And
Yeah.
ladies and gentlemen, we were just talking to Dr. Silvam Sellapan, who is the consultant obstetrician and gynecologist with a special interest in gyne-oncology from Columbia Asia Hospital, Puchong. Thank you so much, doctor. Anything else you would like to add before we sign off?
No, thanks. There's one more question coming up. Okay, can I answer? Okay. How is fallopian tube becoming a risk factor to ovarian cancer? Okay, they shouldn't misunderstand this. You are not going to plug out all the fallopian tubes. Those who have completed the family, we don't go and do a surgery to take out the fallopian tube. Only if you require any surgery for some other reasons, you can actually remove the fallopian tube, which has been found to have some risk factors for her to develop ovarian cancer in later part of her life. All right. So again, I emphasize we are not going to remove. We are not going to do a specifically a surgery to go and remove the fallopian tube. In the event she's undergoing a surgery for some other gynecological problems, then the gynecologist can bring out this fact, and if she's willing to remove the fallopian tube because of the evidence, then she can actually remove the fallopian tubes, which may reduce the risk of future ovarian cancer.
Okay. All right.
All right.
Doctor, there's one more question, but this is actually coming from me. I mean, since we're
Uh,
on.
sure.
There are, well, we know of Angelina Jolie, who had both breast removed because she had breast cancer history in the. So, what is your stand on patients who actually insist on removing their organs, especially in the reproductive area? Let's say they ask to remove ovaries, the womb, the cervix, the uterus, so that they will not be able to get cancer. But of course, this is after they've had children,
Yeah.
and if they are in a high risk group, especially. Have you ever had anyone?
Angelina Jolie, of course, she's a popular figure, and then of course her action brought a lot of attention. Of course, it's also brought a lot of awareness because
Yeah.
her risk of estimated risk of getting breast cancer was estimated at 87%.
Yes, that's right. Yeah.
Based on her family history, because this is something they go for genetic screening. There's BRCA, BRCA screening. It's quite expensive though. If you have a strong family history, just to emphasize here, most of the breast cancers are de novo, that means without family history, most of the breast cancers.
Yeah.
Okay? About 5% of family history. But if you have a strong family history, you want to do advice, of course, you can go for this screening, BRCA screening. For Angelina Jolie, she had a high risk. She actually removed her breast after, I think, about 1 year, 2 year later. She removed pelvic organs as well, the
Oh,
uterus and ovaries. Okay, she did that. I have some patients here also in Malaysia. They have removed their pelvic organs because of the perceived risk.
mm,
It depends on the probably if you have a strong family history, whether you can go for regular screening. You always can actually consult with your doctor. What is the best option available? It is not always must go and remove the organs. A risk assessment can be done. If you can do a risk assessment for, I mean, each individuals have a risk factors. Okay, the person A can have a risk factor, the person B can have a different risk factor. So based on the risk factor they have, the consultant can give his opinion, so the patient can have a best or whatever the best decision can be made. All right?
okay. You can do a risk assessment at the hospital also with the
Yes, yes.
gynecologist.
Yeah,
Okay.
yeah.
Okay. Okay. I guess we can wrap things up now. Thank you
Yeah.
so much to everybody, to all those who asked questions, and also especially to Dr. Silvam for making time to be with us today.
Thank you.
Until ke lain kali, inshallah we'll see you all again soon. Tomorrow actually there's a session, so we'll see you all. We'll be talking about handling back pain. Okay, thank you and good afternoon. Bye.
Okay, thank you very much. Bye.
Bye.